bringing your signs to help stand up and make the point of what's here. And now it is my pleasure to introduce someone who has had a long and distinguished career standing up to represent everybody, everyone's civil rights, poor people, people on the margins, people to have access to healthcare, people to have education. One of our real leaders in the Colorado Senate, I told you before, she's our president pro tem, but we are absolutely fortunate to have her leadership in the Colorado State Senate, and you are lucky to have her out there fighting and representing to you. Let me introduce our president pro tem, Senator Betty Boyd.
Here with you today. I too love the signs. Got a few favorites that I can see from here. But you know, for years, Senator Carroll is right. For years, I've been fighting for women's choice, women's right to choose, women's right to do what they wish to do. Period. As a champion of choice in the legislature, and through the passage of emergency contraception legislation after The other hat that I wear is the chair of the Senate Health and Human Services Committee. And that's another reason that this proposed amendment is so offensive. Because the Blunt Amendment is not only a war on women, it's a war on critical health services. The proposal would limit consumers' access to many, many vital services, such as vaccinations, substance abuse treatment, counseling, in vitro services, mental health care, reproductive health services of all kinds, HIV/AIDS treatment, even mammograms and maternity care, and certain cancer screenings. The federal legislation requested in the Senate Memorial, or the Blunt Amendment, were to be enacted, it would potentially result in the loss of access to services that are or will be required to be covered under the Federal Health Reform Act. The proposal could possibly result in Coloradans losing access to the services they need when they need them. Allowing employers to deny coverage to save money by using conscience as an excuse actually costs the taxpayers money. At a time when we're trying to keep people covered in the private sector, allowing employers a free rein over reducing their medical coverage for financial or presumed conscience reasons would throw more citizens into the private sector, and it would cause more people to be uninsured at a great cost to the taxpayers. All women should have access to contraception, no matter where they live. How a woman controls her menstrual cycle is none of your business. It's preventive health care. It allows women to pursue economic opportunity and is a matter of individual choice. Even the Institute of Medicine recommended that birth control be included as a preventive health care benefit because it fundamentally improves a woman's health and the health of their families. It saves lives, prevents unintended pregnancies, and improves outcomes for children, and actually reduces abortion. The birth control coverage benefit is one of the greatest advancements for women's health in decades, and it ensures that millions of women will have access to affordable birth control. The typical woman spends 5 years trying to get pregnant, or actually being pregnant, and another 30 years trying not to get pregnant.
Yeah. Yeah.
So this
That's
is a
the
common
truth.
sense issue for all women.
Yeah.
You know, because it's such basic health care, even excluding birth control from coverage has long been considered discrimination against women. Prescription contraceptives are used exclusively by women who uniquely have the opportunity or the potential to become pregnant. The failure to provide coverage for prescription contraception in health plans that otherwise cover prescription drugs and devices singles out and treats less favorably the medication needed for pregnancy-related conditions. So, the health ramifications of this amendment are huge. You know, birth control was really a wonderful opportunity. It provided incredible opportunities for women to finally be able to control their families, family planning, so that they could have a modicum of independence. They could go out and get an education. They could work outside the home. You know, they had the opportunity to be involved civically and even to run for office as a result of this.
Yeah. Woo!
Maybe that's why it's so scary.
Yeah.
But the last point that I want to make is from a faith perspective. I am a person of faith, and I am very offended that someone else is trying to use their faith and their belief system to trump mine. There's a reason for the separation of church and state.
Yeah.
And it's not to protect the government from the church.
Yeah.
Thanks for being here, and you know, go forth and spread the word that we need to elect people who support women and support women's rights to contraception.
Yeah.
Unfortunately, we don't have time to allow all of our legislators to speak, but I just want to acknowledge the people on the stage. These are the good guys.
Yeah.
Good women, I mean, sorry. Great, strong leaders all. Thank you. And you're invited to stay here on the stage if you like. We have a couple more speakers before we have the House side. So if you want to stay, hang out. Next, we have the Raging Grannies.
Woo! Laura isn't here yet? Was Kathleen coming?
Hey, what do you have there, Chris? Well, if you could help out by getting that to MoveOn, basically it's going to be going through this week. These people last year. Want to take coffee too? Oh, failed on one vote.
It failed by only one vote?
They're going to the House. Because the House is expected to pass. Right, policies through the people. And that's the thing of my plans.
Okay, so it's quite an undertaking, but it can be done. Yeah, I'll make sure this gets presented to Denver Metro.
And are these the ones who are for or against it?
They're against it.
Yeah, they're the ones that voted against.
So these are the ones we need to
Contact,
talk to.
Yeah.
protest.
Yep. Yeah.
I
Who's
think
going to go for a fair vote?
right? Cool.
So yeah, if anything needs to help.
Yeah, okay, Chris, I'm glad you gave that to us. Appreciate it.
Yeah, we'll get it up.
And thanks for coming to our rounds and stuff, George.
Yeah.
Oh wow. Thank you.
Yeah, we definitely want to do coalition building, that's for sure. We want to work with all the other groups.
Are you guys gonna be down at May Day?
I have a doctor's appointment that day, so I'll be there.
More likely to be there for sure.
Alright, because stop on by my table. It's gonna be disseminating this information.
It's gonna be good, right?
Yep. And I'll have some news with me.
Okay. Yeah.
You have to barter something for it, even if it's a joke.
Okay. I'll see what I can conjure up.
Alright, cheers.
Thank
Cheers,
you.
Chris. Thank you.
No more money stealing tricks. Stop the war on men. No means no and always will. No more domineering
She wants to
tricks.
talk to him.
Stop the war on doctors.
Thanks, Randy. Yeah.
Women's needs are too important. Roe v. Wade's along with it.
Yeah!
Healthcare will be coming of my name. Better healthcare will be coming our way.
Yeah, we can just turn it off for a little bit, or you want...
Everybody